So my opinion on high volume practices, I think they're great. They help out a lot of people. It's a little bit different than how we practice here at Athlete RX. We really focus on having the intentional time with people. One thing that pushed me more toward the little bit longer appointment times that we have was my mom actually, and she went to a chiropractor, and the chiropractor, I don't think she knew or he knew her name. And the other part of that is when she would talk to me about it, she was like, Zachary, just make sure if you see somebody in the grocery store, you see a client in the grocery store, make sure you know their name. It's important to me, and I really took that to heart with how we structure our practices with versus like a high volume clinic. And I think the results at each one of them, and each one of them has their pros and cons, but one of the things that really drove me to do more of the longer appointment visit was the time and the connection that we can have with clients, and really being able to recognize them over the course of their treatment, and they're not just a statistic. I'm really looking at that communication that we have with the client, that relationship. So what I think patients should consider when they're deciding between a high volume clinic and a more patient-centric clinic like our clinic, where we have more time with clients, is really what you're trying to get out of the visit. Some people do great with a 3 to 5 minute adjustment, and they're in and out the door, and it's very convenient. Other people, at least specific with my clinic, my clinics are that we are intentional. We're able to do a workout. We're able to talk through some of the issues and really get a clear message and a clear goal and a clear direction for that point of healing. So really deciding between, hey, do I want it to be convenient, I'm in and out of the door, or do I want to spend a little more intentional time, get a little more long lasting results, in my opinion, but also having that genuine connection that we really strive for at our company. That's really the big thing that I look at for patients considering when choosing between a high volume clinic and our clinic. There's great positives and negatives about high volume clinic. Volume is great in most settings. Just personally, and this is just my personal opinion, I like spending time with people. I like developing a genuine relationship. And in high volume clinics, I don't feel really gets you to that point for connecting with clients and really establishing yourself as the go-to person in your area. Really looking at that time aspect of it is super important when looking at the positives and negatives of a high volume clinic. Some of the positives is you're able to help a lot of people in a very short amount of time. They may have way more visits during the week, but some of the negatives is, again, that connection that I really strive for with our company is really being able to notice them on the streets, knowing them by the first name and some of their family members, their dogs' names, their cats' names, and really connecting with them on that personal level. So the reason why I chose quality over quantity is more of a personal reason. I'm also listening to family members and people who have been to other chiropractors, is really focusing on that quality time together, really communicating, hear the client's message and communicate those things properly so they get the best results in the shortest amount of time. And we're actually able to work through those things a little bit more in depth when we have a little more time with people. So we manage our time here with 30-minute appointments. We're able to really talk through some issues, look at the goals, look at the long-term benefits, really get some great feedback when we're doing workouts with clients, or even just having them do a couple movements and see, hey, well, how does that feel? Does it feel different when your hip is in this position or when your knee is in this position? And really getting that feedback and building that communication, that platform for trust really with our company. And that time is very, very important to us, where, hey, when we are looking at managing that time, that 30-minute appointment is we really get a lot done, so that maybe I can see you once a week instead of 3 times a week like a high volume clinic. Just really being able to manage that time efficiently so that 30-minute appointment, we're getting a lot done. Dry needling, shockwave, if they need any hyperbaric or stretches or mobility, and that's all on top of your adjustments and soft tissue work. Working through all those things help us really manage expectations, help us manage improvement with all of our clients.